Bathing is an important part of personal hygiene, as it cleanses the skin, makes the patient more comfortable. It stimulates the circulation and relaxes the patient, as it gives a good opportunity to serve and observe the client body, and as well as communicate with the patient. The procedure given was a complete bed bath, or also known as the CBP, in which the health assistant baths all parts of the body, which includes the oral hygiene. The implementation of this action starts with reviewing chart for any limitations in terms of physical activity, as this prevents the patient discomfort and injury. Second, we bring the necessary equipment to the bedside stand or overbed table, as it conserves our time and energy. And then we perform our hand hygiene and put on gloves and other PPE, as PPE prevent the spread of microorganisms. PPE is required based on transmission precautions. After identifying the patient and providing privacy, we loosen top covers and remove all except the top sheet. Place bath blanket over patient and then remove top sheet while patient holds bath blanket in place. If linen is to be reused, fold it over a chair. Place soiled linen in laundry bag. Take care to prevent linen from coming in contact with your clothing. The patient is not exposed unnecessarily and warmth is maintained. If a bath blanket is unavailable, the top sheet may be used in the place of a bath blanket. Next, we remove the patient's gown and keep bath blanket in place. If a patient has an IV line and is not wearing a gown with snap sleeves, remove gown from the other arm first. This provides uncluttered access during the bath and maintains warmth of the patient. IV fluids must be maintained at a prescribed rate. After we fill the basin with sufficient amount of comfortable warm water, we fold the washcloth like a mint on your hand so that there are no loose ends. We start to bath the patient's face, neck, and ears. Also, we lay a towel across the patient's chest and on the top of a blanket. And then we expose the patient's forearm and place towel lengthwise under it. Using firm strokes, wash hand and arm and axilla, lifting the arm as necessary to access axillary region. Rinse if necessary and then dry. Soak the patient's hand in basin. Wash, rinse if necessary and dry hand. Placing the hand in the basin of water is an additional comfort measure for the patient. It facilitates through washing of the hands and between the fingers and aids in removing debris from under the skin. Exposing, washing, rinsing, and drying one part of the body at a time avoids unnecessary exposure and chilling. Areas of folds of skin may be sources of odor and skin breakdown if not cleaned and dried properly. Place towel under foreleg using firm strokes, wash, rinse if necessary, and dry leg from ankle to knee and knee to groin. Repeat the actions for the other leg and foot. Make sure patient is covered with bath blanket. Change water and wash clothes at this point or earlier or even if necessary. The bath blanket maintains warmth and privacy. Clean, warm water prevents chilling and maintains patient comfort. Help the patient to put on a clean glove and assist with the use of other things. And also, don't forget to remove the bath blanket. Along with that, provide the blanket that needed for their own warmth and privacy. When finished, make sure to remove your clean gloves and use hand hygiene. The easiest way to wash a patient's hair is to assist him or her in the shower, but not all patients can take showers. If the patient's hair needs to be washed but the patient is unable or not allowed to get out of bed, a bed shampoo can be performed. Shampoo cups are available and are being used with increasing frequency. This commercially prepared disposable cups contains a rinseless shampoo product. See the accompanying skill variation. For the implementation of this action, we need to review the chart for any limitations in terms of physical activity. Next, we perform our hand hygiene. Put on PPE as indicated, and then we identify the patient. Explain the procedure to the patient. After that, we provide her privacy. We remove the pillow and place protective pad under the patient's head and shoulder. After that, we fill the pitcher with warm water. Position the patient at the top of the bed with a supine position. Have the patient lift his or her head and place shampoo board underneath the patient's head if necessary. Pour the pitcher of warm water slowly over patient's head, making sure that all hair is saturated. Refill the pitcher if needed. Gloves prevent the spread of microorganisms and also washcloths prevents water from running into the patient's eyes. By pouring slowly, more hair will become wet and it is more soothing for the patient. Apply a small amount of shampoo to the patient's hair. Massage deep into the scalp, avoiding any cuts, lesions, or sore spot. Shampoo will help to remove the dirt or oil. And then, we rinse it with the water until all shampoo is out of the hair. Repeat the shampoo if necessary, because shampoo left in hair may cause pruritus. If hair is still dirty, another shampoo treatment may be needed. Pat hair dry, avoiding any cuts, lesions, or sore spots. Remove protective padding but keep one dry protective pad under the patient's hair. Patting dry removes any excess water without damaging the hair or scalp. Gently brush hair, removing tangles as needed. Removing tangles help the hair to dry faster. Brushing hair improves patient's self-image. Blow dry if possible. And then change the patient's gown and remove protective pad and replace her pillow. The patient's oral care. For the implementation of this action, we need to perform hand hygiene and put on gloves if assisting with oral care and other PPE. Identify the patient and explain the procedure to the patient. After that, we provide the privacy. Place a towel on the patient's chest in order to maintain cleanliness. We place the brush at a 45-degree angle to the gum line, and then brushing from the gum line to the crown of each tooth. Brushing the tongue and then holding the emesis basin for patient to rinse and spit. Next, assist the patient to floss teeth, if appropriate. Remove approximately 6 inches of dental floss from a container or use a plastic floss holder. The floss must be held taut to cut between the teeth. Trauma to the gums can occur if floss is forced between teeth. Massage has many benefits including general relaxation and increased circulation. It can also help alleviate the pain and can be incorporated into the patient's bath as part of the care before bedtime or at any time to promote increased patient comfort. Assist the patient to a comfortable position, preferably prone or side-lying position. Remove the covers and move the patient's gown just enough to expose the patient's back from the shoulders to the sacral area. We perform different procedures while massaging the patient. It could be a friction, tapotement, and even the kneading.